Good evening, ladies and gentlemen. My name is still Lanre Ajayi, and I'm your host on the Global Talkative Series. Anywhere you are, good morning, good evening, good afternoon. Thank you for joining us on this special edition of the Global Talkative Series. For the benefit of our viewers, we're broadcasting live on Facebook, Instagram, and on YouTube, just to make sure that we are getting everybody involved in this. Thank you for those who are joining. Bold and blessed. Thank you, Nelson. Thank you. Dr. Badari from Nigeria, thank you. We appreciate you. And we have a guest. So we have our doctor, Laiwala Ajile, is going to be joining us in a few minutes right now on Instagram. So I just want to send an invitation to you, Doctor. Laiwala Ajile is going to join us in a few minutes right now on Instagram. So I just want to send an invitation to you, Doctor. Okay, I can see Dr. Gillette.
Yeah.
It's going to be a wonderful time today. Waiting for Dr. Agile is joining right now. I'm going to see you on Instagram shortly. Waiting for Dr. Agile is joining right now. I'm going to see you on Instagram. Oh, good. So, can you reduce the volume of your? Okay. That is.
Yeah.
Okay. So maybe you need to turn down a little bit the volume of your laptop or. That is very good. That is very good. So right about now we have Dr. Olaiwala Jile, all the way from the United Kingdom. We're still having some. Okay. I think it's okay now.
Okay.
Yeah.
I think we're set.
Yeah, thank you very much for a wonderful time. Today we have a guest from United Kingdom, Dr. Olaiwala Jile. And as we do it on this show, I'm just going to read a profile of Dr. Jile before we go into today's discussion. So I'm just going to start. Dr. Olaiwala Jile qualified in medicine and surgery at the College of Medicine, University of Ibadan in 1997, and is specialized and trained as a psychiatrist and forensic physician with the Royal College of Psychiatrists and Royal College of Physicians, Faculty of Forensic and Legal Medicine in the United Kingdom. He has a certificate in adolescent addiction studies from Keele University in UK. He has special interest in general adult and old age psychiatry and addiction psychiatry. Dr. Agile holds a master's degree in international health management, policy and development from the prestigious School of Public Policy, Center for Health Management, University of Birmingham, UK. He has a diploma in health insurance and management from Chartered Insurance Institute of London. He has extensive experience in health insurance development, management, health financing, and economics in Resource Limited Economy. He is the CEO, MD of Valor Health Options and Pivot Medical Services, United Kingdom. He works with the National Health service, NHS in Birmingham, as a contracting consultant, psychiatrist, this year, I'm not sure, for as forensic physician. That puts him in the front line of COVID-19 response. Dr. Gile has written and published several articles on medical sociology in illness and public understanding of health-related issues, global affairs, and immigration. One of his articles published in 2009, Death Without Notice, informed today's topic of discussion. He is married to his beautiful wife at DBC, a senior biomedical scientist and team leader, manager, microbiologist with Public Health England. He's a father of three and he enjoys playing piano and violin in his spare time. That is an impressive resume, Dr. Yele.
Thank you so much. Thank you.
Now, before going to the nitty-gritty of today's topic, tell our audience your journey from back home in Africa to now becoming one of the most sought after forensic physicians in the UK. Take us back memory lane.
Thank you for having me on your show, Larry. Before I go into all that, I think I need to commend your work for bringing me to this Global Talk Active series and bringing this program to the global audience. I think you're doing a commendable job, and you need to be praised for that. I think you asked a very personal question there, and my journey from Africa is a personal one, I have to say, and it's a journey of dedication. It's a journey one that I'm very proud of, and I'm thankful to God for. I'm thankful to God because it is indeed a journey of commitment, focus, dedication. It's a journey of persistence and resilience, and it's also a journey that is involving a lot of grace of God as well and the favor of mankind. That includes my family members. For example, Justice Pamela Gile, blessed memory, my uncle. And there are so many other non-family members also, like Chief Mrs. Ogundoyin and Dr. Abiola, Chief Executive of Indulge Nigeria Limited. I think the question is, why medicine and surgery?
Yeah, why did you choose that?
Yes, and how did I get into one of the best medical training universities in the continent of Africa? There was a book written by Bode Akindele, the Nigerian billionaire, in his memoir. He said, I did it God's way. But I think in my own case, it's about God doing it his own way. Because if you look at it, I came from a very humble background. My journey started at the age of 14, 16, when my father was in a hospital and admitted very ill. And I needed to visit him at the University College Hospital. Prior to that time, I was just a young boy, just having a good time. I didn't know what I wanted to do at the time. Visiting him in the hospital, actually, and going into the environment of the University College Hospital changed everything, because it was an environment I had never been before. And I saw people there who were in white coats, and I was quite impressed by what I saw. And I started asking questions. I mean, who are these people? How did I get here? And that was how the idea of being a medical doctor came about.
Wow.
So it's something that came about from what you can say a personal tragedy. My father eventually passed away that year. And that actually, changed everything for me. I think I started making inquiries on how I can become a doctor. As you know, I went to a secondary school that was only barely 3 years old. We were just the third set of people admitted to this school. Prior to that time, there was never anyone who went to university, let alone study medicine. And I felt, I needed to up my game. So I think the journey started from there. So I, in my own way, had to manage to blend the imperatives of learning audaciousness and ambition, character, and also um, insatiable appetite for knowledge, in forming a sound basis for learning. And that took me to everywhere. I started reaching out from my school to other secondary schools outside who in the past had produced medical doctors. For example, about the boys' high school, about the grammar school students. I started mixing with them because I wanted to learn from them. I realized that I needed to be an outstanding student in science and mathematics. So therefore, I needed to learn a bit more. So my appetite for science and acquisition of knowledge became very deep. And I told my uncle that I really would like to be a doctor. He was quite happy, to be honest, because he said, that is it. I've been looking for somebody in the family who will be a medical doctor. He
That's
was
good.
ready to join, And he said, I thought your father would be able to do it, but here you are. You want to be a doctor, I'm going to support you. Whatever you need to do, I will support you. And that was when the race started. I became very, very serious. Rather than being very playful and sporty, I became very studious. And I've made a number of choices in life, which was very important at the time. I think it's about to let you know that the choices you make in life can also make or marry you. At that time, I was just in my final year preparing for GCSEs. Obviously, I knew I needed to pass my GCSE with straight A's before I can get into medicine. Because after making some inquiries, I realized that without those kind of results, you cannot get there. It's very competitive. I mean, we're talking of one of the best, medical training institutions in the continent of Africa. There are about 3,000 applicants per year. We make application for about 100 or 120 spaces. You can imagine how competitive, it was at the time. And I was just 15 to 16 years old. Um, so I needed to up my game. I started studying very seriously. So luckily, I passed my GCSE, no previous, examination, no extra lesson. I was stuck on my own, trying to, bury my head in the studies. My uncle was very, very encouraging. He would come and check me and say, "Good boy, you're doing it." So he gave me all the support, morally, financially, in so many ways. So I was lucky to pass my exam in straight A's for my GCSE, and that is where the choice and the decision you make after that made the difference between me and the rest of my classmates. I think up to now they still ask me how did I make it, and this was actually the crucial decision that changed everything. Apart from visiting my father in hospital, deciding I wanted to be a medical doctor, but I needed to get into that. But that choice was very important. At the time after GCSE, most of my classmates would go to, maybe college of education, polytechnic, but I decided I needed to do an A level. So I went to government college Ibadan. I made a choice to go to government college. I think I was the only one that didn't, transit to polytechnic. I decided I needed to, dip my root further in science, and that actually, changed my entire outlook in life. And in government college, I met quite a lot of brilliant, exceptionally brilliant people, and I made good friends, lifelong friends, like Benga Koka, Chola Konde, and some other people that I met there. I studied for my entrance examination and matriculation for the university, and I I passed. So I was lucky. I got into the University of Ibadan. My uncle was exceptionally very happy and very proud of me, and that was how the journey started. And I, stayed in the university for another 6 to 8 years. It should be 6 years, but because of the incessant strikes and all those things, I think eventually we spent 6 years. And 10 years later, after visiting my uncle at the hospital, I was graduating with a degree in medicine and surgery. And that was how the journey started.
Mm.
And here we are today. The rest is history.
Wow. That is a very, 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 we should turn your journey into a movie.
Well, absolutely, absolutely. It is an inspiring story, to be honest, and I'm very proud of it. And as I said earlier, I thank God for the grace to be able to do it.
Yeah, that's cool. So now I read some of your article, and one of them really, make an impact, especially when we lost the pop music icon Michael Jackson in 2009.
Yeah.
That is what inspired today's topic, death without notice, one of your many articles. Now, the first question that I want to ask, because we have some audiences who have sent in some questions, from around the world. And then I have this question myself, that could COVID-19 be death without notice to human race?
Absolutely. So I think you can draw a sort of analogy between the two. I think that particular article was written in 2009, and it was written in the context of sudden death syndrome when Michael Jackson died. And it was just to highlight the importance of periodic health screening, particularly for people with underlying cardiovascular risk factors like obesity, diabetes, hypertension, high cholesterol. And that was the reason why the article was written, actually co-written with Dr. Bisi Abiola. Now, you have to draw a comparison between that and what we are seeing today. I mean, we are in the middle of a global pandemic. I mean, at the beginning of this year, nobody expected, that, the whole world was going to change rapidly the way it has changed now, with people taken out, from the midst of us because of this COVID-19. So it came without notice. I mean, it's like a war, invisible war that everybody is fighting, and a lot of people, have lost their lives because, of this particular situation we found ourselves. So it was a good comparison, and it's actually a very appropriate topic, to discuss today. COVID-19, as we know, it's a viral sort of infection, which primarily affects the lung. It belongs to the family of the uh, um, acute respiratory distress syndrome. And basically, it just sniff life out of you. And it comes without notice, nobody sees it, and you can't really know or tell who is going to get it or not. So people can be well and healthy today, and the next week you will hear about them. They're already under intensive care or having to use, ECMO, that's extracorporeal membrane oxygenation machine, to be able to keep them alive. So it is a very, very deadly and virulent infection, and nobody knows how it came about. I know that there are a number of conspiracy theory about how this came about. We heard in the media about the origins from Wuhan in China. There have been people who have thought that this was a man-made pandemic. Some people thought perhaps it was just an accidental infection. But the fact is that it's come and it's here and it's killing people right, left, and center. And those people who have survived it have been able to have been left with a lot of, telltale complications as well, which is one of the areas where I'm dealing with my own area of practice, psychiatry, for example. I've been quite a number of people who have developed a serious mental health issues or whose mental issues have become more complicated as a result of this COVID-19. So yes, we can actually draw a comparison between death without notice of 2009 and what we're experiencing now. It's just that in this situation, we have a large number of people being taken away from us, whereas, with in 2009, where that particular article was written, it was just mainly for people who have pre-existing cardiovascular health issues who were prone to having sudden death. But here we're having everybody's exposed, everybody's at risk to COVID-19.
Okay. Yeah, so for the benefit of our viewers all around the world, if you've got any question for Dr. Lai Ajile, if you're on Instagram, on YouTube, you can just post your question. It's going to show on the screen, and then we'll be able to read the question out, and then others can benefit from your question, and Dr. Lai will do justice to the question. And if you have a question as well, if you're watching us on Instagram, kindly post your question, and then read the questions out, for Dr. Lai to solve the question for us. Thank you for those who are joining us right now. David Shershen from Nigeria, thank you for joining us. We have Caroline, Caroline Voice, thank you for joining. Tayo Ajila, thank you. B. Ajayi, Fisayo Ajayi, Adebola Adedutan, Lanre Amushan, the editorial Dr. Editorial Board. Thank you for joining. So it's amazing that people are really interested, and you can join us on facebook.com/diamondchurchx on Facebook to watch now, or on Instagram at Lanre Ajayi1 or at Lanre Ajayi on YouTube. You have, this, you can just join us on all this platform. So going to the question, Dr. Lai, is there a correlation between COVID-19 and the dynamics of forensics?
Well, we can draw a correlation, but not a direct correlation. Obviously, I work in the field of forensics, and that is mainly, healthcare is the interface between medicine and criminal and civil law, basically. But in terms of forensic, analysis of what's going on, there's really no direct correlation. But the way you can make a correlation is the fact that, nowadays, in the lockdown, we are seeing, a drastic reduction in the number of people committing crime, petty crime, coming into, criminal justice system, because everybody is locked down. People are not drinking alcohol, so people are not having to break into, people's shops, or people are not, committing murder because everybody is staying at home. But on the other hand, we are seeing increasing number of domestic violence. So, to that end, there is a sort of correlation. But in terms of COVID-19 and forensics, obviously, nobody is currently in court about, this situation. I think some people are saying, they need to sue China and all those things. That would have taken us to, a criminal, angle. And obviously, there will be a lot of laws that needs to be, looked into to see whether there's any, culpability on the side of China. But in practice, really, the correlation is about the drastic reduction in number of crimes, the drastic reduction in of acquisitive crime, drastic reduction in the number of people, having to commit grievous bodily harm, theft, and all sort of issues relating to criminal justice system. I have to say that things are changing now, especially now that we're coming out of lockdown. We are seeing a number of people, an increasing number of cases being presented to, to us, not only from, psychiatric point of view, also from forensic point of view, because people have been locked down for a long time. Some of them, obviously pre-lockdown have drug and alcohol issues, and now they're free to go out. And obviously, we're seeing increasing number of people drinking alcohol and using, illicit substances. And there is a link between crime and obviously substance abuse. So therefore, there are changing paradigm in terms of the presenting cases to the forensic setting. And where we come into obviously people going out drinking and driving and obviously committing drink drive offense that will come into the purview of a forensic physician. People going into custody with serious addiction problem and obviously need to be in custody for a few hours or few number of days. They would have a need for for intervention, and also because of the inhibition that is taken away by the abuse of drugs and alcohol, people tend to commit more heinous crime like murder, like rape, and therefore they will need forensic attention. As I said earlier, forensic medicine is just an interface between medicine and criminal law and civil law, basically. And it's the same in all jurisdictions, be it in Africa, be it in the United States or Canada. You will find the same sort of things happening all over the place. So that's what we're dealing with now, and that's gonna get worse. That's gonna get worse because obviously there have been a number of interventions in terms of relief package given to people, And some people obviously are gambling a lot more. Some people are having, a lot of aggression issues, anger management problems. Obviously, that leads to a number of, forensic issues, and obviously that's going to increase the number of, clinical activities that we provide in this kind of area.
Okay, thank you very much, Josolai, for that. I've got two questions right now. One from Instagram audience by the name of Adeolu. The
Okay.
question is, are there any similarities between malaria symptoms and COVID-19 symptoms? That's from Adeolu on Instagram.
That's an interesting question, really, and I'm sure it's one that is quite available, all over. I think if there's anything that has been done very effectively with this pandemic is the public health campaign that has been put out there in terms of the symptoms. Malaria, as we know, is prevalent in Africa, in sub-Saharan Africa, and it is not one that you find in temperate climates like in the United Kingdom and the United States of America. So very little will be known about the symptoms of malaria. But generally, malaria will present with high fever, which is also seen in COVID-19 situation. Malaria will present with headache. Very little is known about headache in relation to COVID-19. Malaria will present with obviously fever. Malaria will present with generalized body ache, and very little is known about generalized body ache with COVID-19. I think the core symptoms of COVID-19 is cough, persistent cough, high fever, and obviously difficulty in breathing, which and until recently they've added loss of taste also as part of the symptoms. You can get loss of taste in malaria, particularly with treatment of malaria. Usually people tend to have loss of taste, but I doubt whether the quality of taste difference between malaria and COVID are the same. I would think they're different. Well, there's complete loss of taste in COVID-19, and it's one of those symptoms. So generally, I think the two conditions are two different things, and they exist in different climates. So in Africa, maybe there can be an overlap, for example, between those symptoms, and usually most patients presenting, would have to have treatment for malaria, because malaria, obviously is prevalent in that environment. Whereas in the temperate, climate like United Kingdom and United States and Canada, for example, I don't think anyone would want to be treating anyone with malaria symptoms. I have to say it is interesting that, it's been said that the medication which traditionally have been used to treat malaria is now effective in the treatment of COVID-19, and there have been a lot of trials, and but it is anecdotal. There's no empirical evidence to suggest that it's effective. I'm talking about hydroxychloroquine, and we know that in Africa, many years ago, and even up till now in some areas, chloroquine is one of the main treatment intervention for malaria, and it is now said to be effective also to in managing the COVID-19 and also preventing complication of COVID-19. So between those two, you can draw some degree of similarities, but you have to look at the context between where the patient is presenting in terms of geographical location.
Thank you, Dr. Lai. Now, talking in terms of hydroxychloroquine, we have an audience from the United States by the name of Larry Latz. The question is just spot on. He said, our president in the US suggested daily use of hydroxychloroquine. How advisable is that?
Well, as I said, there is no randomized control trial, which is the gold standard of evidence that you can have the highest level of evidence or systematic reviews or meta-analysis results of data that suggest that hydroxychloroquine is effective. So I think the president in the US, President Trump, obviously out of his own concern for the mortality rate that, everybody, was saying in America, he obviously he was quite keen to sort of find any solution to this pandemic to stall the mortality rate. So I think he didn't state categorically that it is curative, but it was suggested to him, and he tried to sort of put it out to the public to say perhaps we should try this hydroxychloroquine. But there's been no empirical evidence to suggest that this is a curative or has some, treatment properties for COVID-19. I have to say that some people have said that, particularly in Africa, they have used hydroxychloroquine in combination with azithromycin, zinc sulfate, to manage the symptoms of COVID-19, and it's been effective for them. So those are those ones that survive. But what about those people who also have used, hydroxychloroquine and all this combination, and they still deteriorated, and then they still ended up in ICU? So why is it that it is effective in one cohort of people and it's not effective in others? What is the difference? Is there any epigenetic difference between individuals? Are there any underlying factors that makes one person more responsive in a positive way to the treatment of this regime of hydroxychloroquine and azithromycin and zinc sulfate, and whereas other people are not responsive to it? So it's all anecdotal. There's nothing empirical. There's no randomized control trial. There's not enough data to support the use of hydroxychloroquine. So the suggestion by the President of the United States of America was not really evidence-based. It was not evidence-backed, and therefore you can see that there are varying sort of practice across different geographical areas in the use of this medication. But generally, I think the world is frantically looking for a solution to this COVID-19. Everybody is right to try anything that would help, so long it doesn't worsen the existing mortality rate. And there have been other antiretroviral that has been sort of mentioned about their effectiveness. There have been other sort of treatment options which different people have come up with. For example, we know about the COVID organic from Madagascar, which has been controversial and which has not been approved by WHO. So everybody's just trying everything, really, to be honest. But what we know is that the data to support the use of hydroxychloroquine is not strong, and it's not backed with any evidence-based science. So therefore, it cannot be seen to be a standard protocol of treatment for COVID-19.
Thank you very much, Dr. Lai. So I have a question from a Facebook fan. He said, by the name of Adefion Kola. He said, this is the question I'm showing on the screen now.
Yeah.
So there are several unverified remedies on social media. From your experience, what advice or suggestions can you give about this?
Well, I think we have to be very careful, how we take in all those things. All those herbal remedies, and they're just adjunct. They're not, they're not therapeutic. They're not curative, to be honest. So people have different experiences and different outcomes when they use them. So I don't think there's any, orthodox medical practitioner who would, recommend those kind of things. There are things that you can do to improve your immunity, for example. There are things that you can, do to sort of limit exposure, to COVID-19. But generally, those unverified remedies can be dangerous because people tend to overuse them out of, worry and anxiety. It is not prescribed, it is not measured, it is not regulated, it's not been, assessed and approved. And some people have been known to take excessive amount of some of these things. For example, some time ago, I saw an individual who was pounding a large amount of, ginger. And, I don't know what he did with it. Eventually, he took excessive amount and he ended up killing himself as a result of it. People have been known to talk about mixing different, herbal remedies and all sort of things, the back of these, the back of that, the peel of oranges, and mix all of them together. Now the question is that science doesn't work like that. Science doesn't work like that. And what is the evidence that it is actually helping? How do you assess that? What empirical studies or tests can you put together to say this is the evidence base to support the effectiveness of this? And how do you know what particular ingredient in all the mixture is actually helping you? So you can see the confusion there. So there's no standardization, in terms of the intervention. So therefore, everybody's just doing what they like. As I said, you can't blame everybody. This disease is very virulent. It kills people. Who is going to survive it? You don't know. I mean, we have known in the United Kingdom, for example, highly skilled people who have been taken away, surgeons, GPs, professors, and all sort of things like that. So does that mean they don't know about what they need to do? So, there's no consistency and it's not evidence based. So I would say people should err on the side of caution, right? People should not abuse some of these remedies. They should not sort of rely on them too much. I think we should follow the general public health guidance on what needs to be done. If you suspect that you've come across or you've been infected with COVID-19, I think you need to go into isolation. And if you are having symptoms and it's getting worse, you need to obviously call the appropriate line and get the appropriate treatment, and then you will be supported and the treatment will be provided for you. And using and staying at home and using all these remedies can be counterproductive and it can actually be deadly in some cases. So I would generally advise people to be very cautious about them.
Okay, thank you, Dr. Lai. For those who are joining us, this is still the Global Talkative series. We have our guest in the house by the name of Dr. Laiwola Ajile, psychiatrist and forensic physician from the UK. And today's topic is Death Without a Notice, a COVID-19 tale. It's an inspiration article that they wrote in 2009. And we are honored to have him here to discuss, this topic with us. And for this one, just joining us, Pastor Ben and Dia Dekube from Calgary, Alberta. Thank you for joining. Thank you for all those who are joining us from around the world. We appreciate you so much. Thank you. We have a question from Adeolu, on Instagram. He said, from a clinical point of view, what has made the death rate in the US to be increasing above 90,000? That is alarming.
Indeed, that is quite alarming. And you can see, when I say that we are in a global war, fighting an invisible enemy, I mean, I couldn't be, more apt about that. It's only in war situation that you have a large number of people die in mass like that. And the reason we have the high number of death rates in America is multifactorial. First of all, we have to look at the underlying health issue of majority of the people who died in America. I mean, we know, obviously, majority of them are Black and ethnic minority group who have, high mobility in terms of health issues, diabetes, immunocompromised situations, people with obesity, and people obviously with poor and sedentary lifestyle. So obviously that will contribute to the death rate. Other areas of for other factors that could be mentioned. The intervention, obviously, how quick was the intervention from the authority about the situation. I mean, people have said that a more robust public health sort of intervention should have been put in place earlier than when they did it, and that probably would have reduced the number of people exposed to this condition. But honestly, I wouldn't really say that any jurisdiction or the leaders or anything have not done any good job about this. Nobody would want their citizens to just die like that. I mean, for example, in the United Kingdom, I mean, where we haven't had as many deaths as we have in America. Our prime minister even fell a victim, even his wife also had the condition. So, and these are people, obviously, if you want to say they have relatively good health, better than other people. So really and truly, the fact is the deficit in America is very unfortunate. It is the reason is multifactorial, and it can be attributed to the density as well. You notice that majority of this, the large proportion of this 90,000 deaths occurred in New York, and you can understand, the density of New York in terms of the number of people, living in that, very particular city. And if you look at Nigeria, for example, the highest number of incidents of COVID-19, has been found in Lagos, which is the most densely populated, city and also in London as well. So I think there's something to do with the density of the area, and of course that is what COVID-19 feeds on, because it's airborne mainly, and if there's the proximity between individuals are very, very close. Obviously, the likelihood that people will get easily infected, and when you have a number of footfalls more in a very small area, the likelihood that a lot more people will be infected. Now, for those people who got infected, how many of them are going to have progressed with the condition? We don't know. I mean, there's no science to say, oh, this particular person is going to, develop complication and is going to end up having or needing intensive care. And this person is just going to be isolating at home, and that is just it. There's no science yet. It's novel, virus. Nobody knows its properties. I mean, there have been, reports that not only does it affect the respiratory system and shut down the respiratory system, it also causes some coagulation of the blood, and that is quite serious. If that's proven that COVID-19, also increases the coagulation of the blood, then I can explain, and that can explain why a lot of people also die, despite the best effort of the of the experts in trying to save them. Because in a situation where you have the entire blood become excessively thick, and there will be difficulty with perfusion. There will be difficulty with with the flow of blood within the blood vessels, and less likely that people will die of brain injuries, heart attack, and stroke. So you can see that this condition, COVID-19, is not just it's emerging as not only a respiratory condition, even though it's been said to be severe acute respiratory distress syndrome. It looks like it has a multi-systemic impact as well. And and there are studies now in the United Kingdom, which is a large study, which is looking at the effect of COVID-19 on the nerve. I think it's called coronal nerve study, which yeah, exactly. I think it's a collaborative studies between the Royal College of Psychiatrists, the British Society of Infectious Disease experts, and a various number of other expert organizations looking at the effect of COVID-19 on the neurological system. So again, we're looking at a virus that's not only affecting the respiratory system, not only affecting the circulatory system, it's also potentially affecting the neurological system. So and you can see that things are emerging. I mean, maybe as time goes on, there might be, a connection between COVID-19 and the etiology of, some cancers or some sort of things. A lot is known already about, the effect on mental health, which is my own area of expertise, and we're seeing that now. I mean, we're seeing increasing number of illness behavior, where people becoming sick, and the sick becoming well. If you understand what I mean. For example, people who have been well before they develop this illness behavior, they become hypochondriacal. If they cough, if they sneeze, they think, oh, they've got COVID-19. They're isolating, they're worried. It shows that they may potentially affect their family members. And some of them will come to the attention of the psychiatrist. And there are people who have been sick before who have become well. And that is quite interesting because, you know, these were people who, before the COVID-19 and before the lockdown, you know, had a pre-existing mental problem. But obviously, they decide not to come into hospital. So they decide to shut themselves away. So it's like they become well. So they know when you're calling them to say, come for your outpatient clinic, come for your admission, they say, no, sorry, we're staying away. I'm fine now. I'm not hearing those voices anymore, which is quite interesting. Whereas
it's funny.
it's quite funny. Whereas people who have been well, you know, functioning, suddenly become unwell. And they're staying away from, you know, work, they're staying away from family. And we know about, you know, the impact on grief as well. Because the way this condition affects people and mental health is that, you know, when individuals are affected by this condition and they're taken away to hospital, the family members are not allowed to see them. That's against the traditional way in which the British or the American society support each other. So it changes entire, you know, lifestyle and the way we do our things. So people who eventually will die alone. And some family members will not be able to see them. They will not be able to participate in their funeral. And that causes significant amount of psychomobility in terms of how they relate with grief and how they relate with, you know, bereavement and so on and so forth. And also we have a lot of people who, because of the lockdown, they're not able to go out, you know, they're isolated, you know, they can't even reach out to family members. They resort to drinking excessive amount of alcohol, you know, or using drugs or gambling. So there are some addiction, you know, also that you know, that is emanating from this particular situation. And to be honest, there are social complications as well. And I can give you tales, since the topic of today is about COVID tales. I mean, I have in my practice, you know, in recent times during this pandemic, I've seen patients who, for example, you know, was a victim of a serious incarceration, you know, leading to because of domestic abuse, and she managed to, you know, obviously break free from that situation. Now, because of the lockdown, you know, developed what we call post-traumatic stress disorder because she's now locked down again. Whereas in the previous problem, she was locked down by a partner who was beating her, who was traumatizing her, abusing her, and she managed to break free. And many years down the line, she's now being, you know, locked down again. You know, and she feels claustrophobic. She can't go out, and she's developed, you know, post-traumatic stress disorder. Another example, you know, is an individual who, you know, was separating from the husband, ready to sell the home and, you know, go their separate ways. But because of the lockdown, the process of selling the home is shut down. And therefore, she's forced to live with a husband she doesn't love. And she's unable to go out to do her job. So whereas the job before provided, you know, a distraction and an exit from that, you know, unstable relationship. But now she's stuck at home, you know, with a partner she doesn't love. And what did she do to cope? They developed maladaptive coping, you know, mechanism. She resorted to drinking alcohol. She was an alcoholic before. She was dry for many years, but now you know, she relapsed again, drinking again, and she became depressed and became suicidal. So you can see, you know, that this COVID-19 is not just, we're not just talking of a respiratory disorder now. We're talking of a multi-systemic. Yeah, it is all encompassing. I mean, we're talking about the medical complication. What about the economic complication? You know, we can go on and on about that. So we can see that in all ramifications, this is a disease that, you know, suddenly came on us, death without notice. Not only is it killing us health-wise, it's killing our society, it's killing, you know, our way of life, it's killing, you know, family life, it's disrupting, you know, the existing, you know, structure that, you know, the human, you know, have been used to. So a lot is to be, you know, known about this condition, and I'm sure, you know, as time goes on, we will find more to say about COVID-19.
Okay, thank you, Dr. Lai. It's been very, very amazing. In your words, that means density as a way to, you know, extend or propagate the widespread of COVID-19.
Absolutely, yes, absolutely.
So I have a question here. It says, what should we be expecting in days to come, particularly since everything is beginning to open up again? Note, this COVID-19 is still here. It hasn't gone forever. It's still around. So what should we be expecting?
Well, on a positive note, I think the incidence of new infections is is reducing, is improving. The number of deaths that we are reporting is getting better and better by the day. But for every individual that is affected, it is still a total loss. So that cannot, we cannot underestimate the severity and the impact of this condition. But what should we be expecting? I think there's a lot of anxiety, about the future because I mean, those who are well today, those who were dead last week, they were with us the week before. They never knew they were going to die.
Yeah.
So, and we that are here now, we don't know what's going to happen next week. So there is anxiety for the future. And of course, now that we're coming out and there's changes in the restriction protocols in different jurisdictions, a lot more people would get more infected because people are not going out. People are taking throwing caution to the wind, and they're not obeying the social distancing rules. All the advice about public health, sort of approach to manage and minimize the infection rate and transmission between human to human is, it's just not been adhered to. So therefore, we're going to see increasing number of infection again, and that is what they refer to as the second wave. And obviously, people have talked about herd immunity, and perhaps that would help to minimize the impact on people. But again, it's a novel virus. We don't know how it behaves. We don't know what's going to happen. So it calls for a lot of anxiety, and that's the worry, for medical practitioners. And I think my best advice to people generally is that as the lockdown is being lifted and people are going out to to their various walks of life and find means of living, they should actually treat everybody they come across, apart from people of their household, as positive. So therefore, everyone should try and cover their nose, cover their face with a face mask. People say that there's no science behind it, but again, at least these are the advice that's been given. These are the advice that infectious disease experts have given to us, and to some degree, we need to try and do our best to ensure that we're not exposed to this condition. Wash your hands very regularly, and obviously, maintain social distancing. And that's the advice I would give everyone. Generally, I think we should just treat anyone that we come across as positive. Well, on the positive side, I mean, a lot of transactions and interactions now virtual. You are in Canada and the United Kingdom, we're able to interact and see each other. So for those people who can stay at home and who can, do their businesses or live their life on the virtual system, I think they should do that. So the less exposure you have to the outside world, the better for you. So I think, with this COVID-19, if we have the technology, if we have the wherewithal to use this kind of virtual, meeting platforms, I think we should use it so that we are less exposed to this condition. And I think that would be my best advice to everyone anywhere in the world, be it in Africa, be it in the United Kingdom, or in the Northern America.
Okay, so before we go, we have about 8 minutes more. Go on questions before you give a closing remark. So the question is, what lessons can you say this COVID-19 has taught the medical world?
Well, I think one lesson that the medical world, will take away from this is that we are all at risk, and there is need for, global and international collaboration. This is not the time to be fighting, the international, bodies that is meant to coordinate, the response to this pandemic. It's sad what's happening in America with respect to the attitude of the current government and WHO. I think to fight this pandemic, we need all hands on deck. We need all hands on deck. We need the best, effort of everyone to come together to understand. And there's need for information sharing. as well, because we can see that this is affecting anyone. I don't think any country or any individual or person, has benefited in a way, from this pandemic. Yeah, some people may have made some, significant economic gain as a result of it, but the question is that, in a situation where millions and millions of people are debilitated, how happy can you be? Where are you going to spend the money? Because you may have made the billions, but you're still prone to having COVID-19.
Yeah.
You can still die from COVID-19.
Yeah.
Because the only thing, as far as we know for now, that cannot be bought with money, the air that we breathe in,
Yes.
is what it takes away from you, at least from the general pool and body of knowledge that we have now. So it doesn't matter how much money we make from it. I think we need to understand that everybody's at risk and everybody should come together. I know there's a great deal of drive and effort, globally now towards production of vaccine, and how long that's going to take before we find an effective vaccine for COVID-19, we don't know. But until that vaccine that is effective and it is safe for humans to use is discovered, all right, and approved, then we have to continue to work together and we have to continue to follow advice. And coming out from this COVID-19 are also all sort of innovations, which is going to help the world. So there's going to be a drastic change in the way we live our lives. People will travel by flights, less. There'll be less international travel because people can now do their businesses. I've been conducting my training by telephone and video calls, telemedicine, telepsychiatry. Very few patients I've had to go out and face to face see very few patients. And majority of my colleagues also, are doing the same thing, except perhaps the surgeons, obviously who cannot, do their surgery remotely. But obviously, that, with their practice, they've had to make some adaptations to the way they work. So generally, in summary, I think the world needs to come together. We need to, work together, and we need to try and understand that we face a common enemy that's potentially, deadly and can kill anyone at any time.
Thank you, Dr. Laiwola. It's been an amazing time on today's Global Talkative series, talking with the amazing Dr. Laiwola Ajile, the psychiatrist and forensic physician from the United Kingdom. If you like to get more information about, COVID-19 or any information, you can, follow Dr. Laiwola on the Instagram handle. There is I think it's at Olaiwola Ajile.
That's correct. Yeah.
Yeah. So you can see him on Instagram, and you can follow him, and also as well on YouTube. And if you have any question, you can send me any question. I'll get the question across to him. And just in a closing note, we have about 4 minutes more. You mentioned something about hair while you're talking now. And I read somewhere about a bank executive somewhere in South America. It's a wealthy man, but the man died of COVID-19, telling us that it doesn't matter whether you're rich or poor. COVID-19 knows no boundary.
Yeah.
It doesn't care whether you're rich or poor. Now, the daughter of this rich man wrote something. He said, "We left money at home, and our dearest father died of the most, the freest thing. He couldn't afford to pay money for hair because basically those who are dying from COVID-19, they have issue with lungs and breathing properly. So hair that will breathe all over, it's free, but it's the most, the cheapest thing on earth. They are kind of the most expensive now. Hair.
Absolutely.
So what you said, I agree totally. We should do everything necessary to keep our health intact, to be mindful of others, and then to keep our environment safe. I know that doing one thing or the other, we will flatten the curve and we'll get rid of the curve completely. Thank you so much. Do you have any parting words, for our audience?
Well, I would like to say thank you for participating in this global talkative series, and I think it's been an engaging experience with you all, and I found those questions quite intriguing as well, and I hope I've been able to enlighten you and shed more light on some of your curiosities about what COVID-19 is. And I think I have to say, Lanre, you're doing a brilliant job. I think you started this series, and so far you brought brought up quite a wide array of different experts, and it's been a good job that you're doing, and I appreciate what you're doing, and well done for it.
Thank you very much, Osalai. We appreciate your time today on this show. For our Instagram audience, our time is out on Instagram, but we're still live briefly on YouTube and Facebook. And thank you so much for hanging out with us today, for taking time out of a busy schedule. I know you're a very busy man. This is like a season where you'll be working, from dusk to dawn, calls, all around. But thank you for taking time to be with us on this show. We appreciate you. Thank you so much. Greetings to your lovely wife and your kids.
It's my
And
pleasure.
your brother, my friend, Taya and Kinda Jile.
Yeah. Thank you so much. My greetings and my love to your wife and family also.
Thank you very much, sir.
All right, take care.
Come again your way next time with another guest. This is the Global Talkative series with Lanre Ajayi. Bye for now.
Bye. Thank you. Bye-bye.